Welcome! Today we are diving deep into anxiety disorders. Think of this as your ultimate study guide to really nail this topic, not just for your exams, but for your actual clinical practice. We're going to cover it all, from the basics right up to the critical pharmacology.
So, here's our game plan. We'll start with the fundamentals of anxiety and OCD. Then, we'll get into the hands-on stuff, assessment, nursing care, and different therapies. After that, we'll tackle pharmacology in 2 parts, and we'll wrap it all up with a clinical challenge to really test your judgment.
All right, let's jump right in. Before we can even talk about the disorders, we have to get a handle on anxiety itself. What's normal, and when does it become a real problem?
Look, we all have anxiety. It's totally normal. It's like our body's built-in alarm system, and honestly, we need it to survive. But the line gets crossed into a disorder when that alarm bell just won't shut off. It's when the anxiety is persistent, it's way out of proportion, and it starts seriously interfering with your ability to live your life.
Okay, one of the first things you got to get straight is the difference between anxiety disorders and OCD-related disorders. A simple way to think about it is this. Anxiety disorders are mostly about the feeling itself, that overwhelming fear and worry. OCD, though, is about a vicious cycle. First comes the obsession, that intrusive, unwanted thought. Then comes the compulsion, the repetitive behavior you do to try and neutralize the anxiety from that thought.
Now, it's not enough to just say someone has anxiety. The diagnoses are incredibly specific. For instance, social anxiety isn't just about being a little shy. It's a crippling fear of being judged or humiliated. And pay close attention to GAD. See that timeline? At least 6 months. That is a classic detail that shows up on exams, so definitely file that one away.
Okay, let's shift gears into assessment. To build a solid clinical picture and really help our patients, we need to know what to look for, both the risks and the signs.
So when you're assessing a patient, you're basically a detective looking for clues, and these are some of the biggest risk factors. Now, I want you to look at that third point on medical conditions. That QEBP tag means this is a huge evidence-based practice point. You always, and I mean always, have to rule out a physical cause first. Something like hyperthyroidism can perfectly mimic an anxiety disorder. It is a classic NCLEX trap.
So what does a panic attack actually look and feel like from the patient's perspective? It is so much more than just feeling nervous. It's this sudden, terrifying wave of pure fear that completely takes over.
This slide really shows you how intensely physical a panic attack is. It is not all in your head. You've got cardiac symptoms like a racing heart and chest pain, respiratory symptoms like being short of breath. The person often truly believes they are dying or having a heart attack. A great memory anchor for your exam is the rule of 4. You need at least 4 of these symptoms to be present for it to be classified as a panic attack.
Now let's switch from that sudden, intense storm of a panic attack to something different, the chronic, nagging worry that defines generalized anxiety disorder.
Yeah, with GAD, the anxiety isn't a sudden explosion. It's more like a constant, low-level static in the background that just never, ever turns off. And it takes a physical toll. That constant muscle tension, the trouble sleeping, it's just plain exhausting. And over time, it can really wear a person down and make it hard to function.
Okay, so we've talked about the what. Now let's get to the how. How do we, as nurses, actually step in and help? This is where our interventions can literally be a lifeline for our patients.
This slide is all about our nursing priorities. When a patient is in a full-blown panic attack, your #1 job is safety. That means staying with them. That QS alert for a suicide risk assessment, that is absolutely non-negotiable. And notice the QPCC tag for instilling hope. That's a reminder that true patient-centered care means offering genuine hope, not just empty platitudes like, "Don't worry." It's a powerful tool. Milieu therapy sounds kind of fancy, doesn't it? But all it really means is creating a therapeutic environment. The whole idea is that the entire setting, the physical space, the daily structure, the way we interact, is part of the treatment itself. For someone struggling with anxiety, that sense of safety and predictability can be a game changer. All right, let's compare 2 really powerful therapies for things like phobias. Think of systematic desensitization like carefully climbing a ladder. You learn to relax, and then you face your fear one small step or rung at a time. Flooding, on the other hand, that's like being pushed into the deep end of the pool. It's intense, immediate exposure, all at once, to show the person that their worst fear won't actually happen. And now it's time to switch gears to pharmacology. We're going to start with the fast-acting meds, the anxiolytics.
These things can bring quick relief, but they come with some serious risks that you absolutely have to know to practice safely.
Okay, so think of benzodiazepines as the sprinters of anxiety medications. They work incredibly fast by boosting GABA in the brain, which is basically the body's natural brake pedal. It calms everything down right now. But that speed comes at a price. They have a high potential for dependence and can dangerously suppress the central nervous system. That's why they are really only for short-term rescue situations.
Okay, everyone, listen up, because this is a massive must-know safety point. A benzodiazepine overdose is a medical emergency. If you're giving a benzo IV, you are on high alert for respiratory depression. And you absolutely positively have to know the antidote, flumazenil. You better know where it is, and you better have resuscitation equipment ready to go. This is a huge deal.
So if benzos are the sprinters for short-term rescue, then antidepressants are the marathon runners. They are the first-line, long-term treatment for managing anxiety disorders.
This slide shows the two workhorse classes for long-term anxiety treatment, SSRIs and SNRIs. And maybe the most important piece of patient education you can give is about that onset time. You have to tell them this is not a quick fix. It can take up to 4 weeks to really feel the full effect. This is why a doctor will sometimes prescribe a benzo for a short time at the beginning, just to bridge that gap until the antidepressant kicks in.
And here is another critical safety alert: serotonin syndrome. This is a life-threatening condition that can happen if you get too much serotonin in your system. It's a risk when starting these meds, or especially if a patient combines them with other things, like the herbal supplement St. John's wort. You must teach your patients the warning signs: agitation, confusion, a racing heart, and tell them to stop the medication and get help immediately if this happens.
All right, we have covered a ton of information. Now it's time to put all that knowledge into action with an NCLEX-style question that will really test your clinical judgment. Okay, let's break this down just like you would on the exam. What's the core concept of OCD? Remember, it's that two-part cycle. There's the O, the obsession, an intrusive thought that causes distress. And then there's the C, the compulsion, a repetitive behavior the person performs to try and relieve that distress. So what's the underlying reason for the behavior? It's an attempt to reduce anxiety. The answer is C. And for our last one, this is all about clinical judgment. It's a what do you do next kind of question. You've done step 1 of systematic desensitization. You've taught the patient how to relax. So, what comes next? Well, the whole point of the therapy is gradual exposure. You'd start with the least scary thing on their fear list, maybe just looking at a picture of an elevator while they practice their relaxation techniques. It's all about those small, successful steps. So now, what do you think the next step after the picture would be? That's you, thinking like a nurse.